Ever since I started taking science classes, it was always just something that was more interesting to me and something I enjoyed learning. I just really liked the actual science behind it. I really like working with people, so I liked having that interaction and developing those relationships with people and trying to make sure I'm meeting patients where they're at. So instead of having like a rigid guideline of like, this is how I'm always gonna do things, I like to focus on meeting patients at where they're at and what they're comfortable starting with, trying to work with them on where they're comfortable and working from there so that we're both working together rather than feeling like I'm working against them. For me, the biggest thing is working with patients that I feel like I can connect with. So those are usually my favorite days, or days that I get to see patients that I've been able to build those relationships with. And I like having that interaction and developing those relationships with people and not just, speaking to someone once and never hearing from them again, but being able to build relationships with people. One of the things I'm most passionate about in primary care especially is helping people with women's health and mental health, because that seems to be something that's harder to come by in certain places. I just think there's lots of barriers to care there, and there's lots of things that get in the way that maybe shouldn't be there. So that's definitely something I'm passionate about, and just making sure that care is available to everybody regardless of their belief system, and just trying to be an ally to anyone that needs it. We have 2 dogs, and so we spend a lot of time with them, being outside as much as we can, and we love to travel with them, so taking them places with us and just exploring new places. And I like to read, so when I'm not out doing things and when we get to be home, that's what I like to do the most.